What is a wedge resection for lung nodules? Imagine a tiny spot on your lung that needs to be checked or possibly removed. That's where a wedge resection comes in. It's a surgical procedure that takes out a small, wedge-shaped piece of lung tissue that contains a nodule, lesion, or tumor. This approach is often used when doctors suspect early-stage lung cancer or find abnormal tissue that needs diagnosis or treatment. The goal is to remove the suspicious area while leaving as much healthy lung as possible. Compared to more extensive surgeries like removing an entire lobe of the lung or the whole lung itself, a wedge resection is less invasive. It's especially helpful when the abnormal tissue is small and confined to one spot. Surgeons usually perform this procedure using minimally invasive techniques, most often called video-assisted thoracic surgery, or VATS. During VATS, the surgeon makes several tiny cuts in the chest, inserts a small camera, and uses special instruments to carefully cut out the wedge-shaped piece of lung tissue. This method results in smaller scars, less pain, fewer complications, and a quicker recovery than traditional open surgery, which involves a larger cut between the ribs. Wedge resection is a good choice when a lung nodule looks suspicious but is small and localized. It is often used for early-stage, non-small cell lung cancer or carcinoid tumors. Sometimes, doctors also use it when biopsy results are inconclusive or when less invasive methods cannot provide enough information. The main aim is to remove the abnormal tissue for diagnosis and treatment while preserving as much lung function as possible. Because the lungs are divided into lobes and segments, removing just a small wedge means less lung tissue is taken out compared to other procedures like segmentectomy or lobectomy. After surgery, doctors usually place chest tubes temporarily to drain air or fluid that might collect around the lung as it heals. Recovery tends to be faster with minimally invasive surgery, but the exact approach depends on the patient's overall health, the location of the nodule, and the surgeon's judgment. Emerging techniques are also being explored, such as non-intubated wedge resection, which aims to reduce anesthesia risks and improve recovery, especially for patients who might not tolerate general anesthesia well. These options still allow for tissue diagnosis and can be potentially curative for early lung cancer. In summary, a wedge resection is a targeted surgical method to remove a small part of the lung containing suspicious or cancerous tissue. It is mainly used for early-stage lung cancer and offers the advantage of preserving lung function and minimizing surgical impact. Always remember that treatment decisions should be made in consultation with a healthcare professional who can tailor options to each individual's needs and medical situation.